Good evening, everyone, and welcome to the Family Engagement Series sponsored by Prince William County Schools. Tonight's session will focus on understanding your teen, a parent's guide. Tonight's presentation will be presented in English and will be recorded. Tonight, I would like to welcome you, Ashley Summers with Dominion Hospital. Welcome, Ashley.
Thank you, Heather. Good evening, everyone. Thank you all so much for being here today. We're thrilled to welcome you to this important parent workshop focused on mental health and understanding your teen. We know how busy life can get, so we truly appreciate you taking the time to join us for this meaningful conversation. As parents and caregivers, we're all navigating the challenges of supporting our teens through their ups and downs, mood swings, big feelings, and everything in between. Today's workshop is really designed to offer insight, tools, and support as we explore how to better understand and connect with our teens, especially when it comes to their mental health and emotional well-being. We're incredibly fortunate this evening to have two highly skilled presenters with us today who bring both expertise and compassion to this topic. They'll be sharing valuable information, practical strategies, and they'll answer your pre-submitted questions. We hope you leave today feeling more informed, supported, and confident as you continue your parenting journey. Again, thank you for being here. We'll get started. As I said in the beginning, I am Ashley Summers. I'm with Dominion Hospital. Dominion Hospital is a freestanding psychiatric hospital located in Falls Church, Virginia. So we treat children, adolescents, and adults with any type of mental health crisis through inpatient programs and also day and evening programs. This evening, I'm super excited because two of our presenters I have had the pleasure of working with, and we are very fortunate to have them here tonight. Dr. Nene is one of our presenters this evening. He is the Chief Executive Officer as well as the Chief Medical Officer of Bloom Health Centers. Dr. Nene, prior to joining Bloom, or prior to creating Bloom Health Centers, Dr. Nene was actually the Chief Medical Officer of Child and Adolescent Mental Health Programming for Dominion Hospital. He was also the founder, along with his wife, who's a psychotherapist, and medical director of a comprehensive behavioral health, CBH, in the greater Washington, D.C. area. Throughout his career, Dr. Nene prides himself most on being a husband, a dad, and a son. In his off time, he enjoys coaching tennis and soccer and playing with his children. Our second presenter for the evening will be Dr. Marin. Dr. Marin is the Director of Acute Services, a psychiatrist, and he is particularly interested in innovative approaches to mental health treatment. His focus includes the use of TMS for treatment-resistant depression, showcasing his dedication to staying at the forefront of psychiatric care. Alongside conventional medication management, Dr. Marin offers patients a holistic and comprehensive approach to mental well-being. So without further ado, I'll pass it over to Dr. Marin, and thank you.
Hi, good evening. Thank you very much for the lovely introduction. Yes, I'm Dr. Marin. We've I guess a little bit about us briefly. We have both Bloom and HCA Dominion Hospital presence here, and this is a photo of Dominion Hospital where I spend most of my time on the inpatient psychiatric unit. And I think we at Bloom have been lucky enough to be able to collaborate with HCA in a lot of our ventures, particularly at Dominion, as they have a child and adolescent inpatient unit and the PHP, and we often collaborate with them and provide more access to care to that really vulnerable population.
So my name's Kristen. I may be presenting a few slides. I am from Bloom Health Centers as well. I'm the Director of New Patient Experience. And our hopes for today are really about empowering all of you. We want to give families the tools and understanding to better navigate the ups and downs of teen development and mental health. We're also here to help make conversations about mental health feel normal and approachable, because they obviously should be. Another big piece is making sure you feel confident knowing that support is actually out there and how to find the right services that meet your teen's unique needs. And finally, we will be sharing community resources with you all so you leave tonight with concrete options and support and not just information.
Yeah, so why does teen mental health matter? Why does child and adolescent mental health matter? I think everyone is well aware that there's kind of a crisis going on in child and adolescent depression and anxiety. I believe since COVID, I think anxiety rates in that population have uh, doubled, and we've seen such a need for more services there. But the idea with focusing on children, obviously improve their mental health, but also half of adults who have mental health conditions, their mental health struggles often began at or before the age of 14. So the key really is early identification, something that we focus on a lot. And the idea is that the sooner that you catch them and get them proper treatment, that they'll have better outcomes later in life as adults. Part of the struggle there, obviously, as parents, is difficult. It can be difficult sometimes to tell what is just normal teenage angst as we all go through that kind of tumultuous time, and what is maybe signs of a deeper depression or anxiety that might really kind of turn into something more. Part of that, and what we're going to talk about a little bit tonight, is destigmatizing mental health support. I think over the past few years, I have noticed more of the language kind of kids will be more open about it, which I think is great. And seeking out that support. But I think we definitely have a ways to go. And then also, why does it matter? I think mental health is, well, this slide says it's as important as physical health. I would argue it's probably vastly more important than physical health in many ways, because you can be as healthy as you can be, but if you're just not enjoying life, and if you're constantly depressed and thinking about, I'd rather not be here, then the physical part really it doesn't matter as much.
Hi guys, I'm Dr. Nene. Nice to meet you, and thanks again for giving us this opportunity to talk to you guys. So teenagers, right? Like, what to expect. I like using the word typical rather than normal. So, typical changes in behavior in adolescence. We want to divide that by certain phenomenon in emotional sets, social, cognitive, and physical. So let's think about that for a minute. Emotional, mood swings, desire for independence. These are all typical, right? As you grow up, get older, as you approach adulthood, even. There's always that shift for independence, right? Shifting away from us as parents, family to peers, which makes us a little nervous. They test our patience, they test our boundaries. But guess what? That's still within the context of typical behavior, right? And we want to be able to determine exactly what's typical and what needs a little bit more support. Cognitively, or how teenagers think, they're really trying to develop an identity. They may engage in risk-taking behavior, but then we as parents need to judge what exactly is concerning risky behavior versus, let's let them be a little bit more independent than usual and go from there. Physically, they're growing. They've entered puberty. They may care more a little bit about their body image. They're exhibiting hormonal changes. Some of them are exploring their sexual identity. Again, typical events in a young person's life. And so my advice to you is, there, like I say here, expect some turbulence, accept some ups and downs. It's okay. It's our job to help you navigate that, but also to provide you with some tips and pointers as to when things should be considered a cautionary light, or when we should expect to reach out for some support. So we accidentally used the word normal here. So typical behavior versus concerning behavior. Let's go over typical behavior. Occasional sadness or irritability, perfectly fine. Moodiness or attitude, giving parents attitude, right? We probably gave it to our parents growing up as well. Sleep schedule changes as the academic load, especially in this area, increases. Maybe we have to adjust our sleep schedule, or as they get into more extracurricular activities, their sleep schedule may be different on weekends versus weekdays, or on certain weeknights. And that's still typical, as long as they're getting their average number of hours of sleep that's recommended by their pediatrician. Again, shyness, being uncomfortable around social situations, or shifting away from things that make them feel uncomfortable. Again, experimenting with their identity, typical in this age group. School struggles, it does not mean that they're setting themselves up for failure. It doesn't mean that they're going to struggle for life. It's an adjustment period, middle school to high school, and even ultimately to college. Not everybody handles that or adjusts well to that, but once given the appropriate support, I'm very positive that they'll adjust quite well. And then, of course, testing boundaries, both in the school system as well as at home. These are very typical behaviors. What are some of the concerning behaviors? Like, what do we look out for? It's really, we want to talk a little bit about their functioning, if their functioning has been disturbed, or if any of these typical behaviors enter what we call extremes of their behavior. So prolonged depression, hopelessness, withdrawal. If their moodiness or attitude all of a sudden becomes rageful, explosive outbursts, temperamental issues. If their sleep schedule is to the point where they're sleeping all day or not sleeping at all. If they're isolating themselves, we've seen that especially now post-pandemic, during the pandemic, we really want to keep a watchful eye on that. If mom and dad know their kids best, right? If at home you suddenly see a severe personality change, like if your typical child, all of a sudden you don't recognize them, or you feel like their behavior has suddenly changed, that's a time to be concerned and potentially reach out. Obviously, somebody who is functioning well in school starts to avoid school, starts not wanting to go to school. And obviously their grades tend to deteriorate, and not due to typical academic distress. It could be due to an underlying mood concern. And when things get a little bit more serious, if they're engaging in self-harm behaviors, substance use, more risky behaviors, such as sexualized behaviors, or gambling, or anything like that, those are causes for concern, and that's where you'd want to reach out for extra support. So when should you seek support? Like I was saying before, persistent sadness, anxiety, or anger, extremes in the behavior changes would be the key terms that I'd like to put out there. Like dramatic changes in their behavior. If their personality has changed, again, social isolation. And social also means it doesn't have to just be friends, also their parents and family, and extracurricular activities. If they're all of a sudden withdrawing from things that they find to be pleasurable. For example, if a person who's on the high school soccer team doing quite well, or even in the rec league soccer doing quite well, stops going, and it's coupled with some motivational issues and isolation, that's something to be concerned over. Academic decline, of course, self-harm, if those dark thoughts or dark wishes ultimately turn to end of life thinking, or talk of suicide, and coupled with if this is new to them, I think that's something to watch out for. substance use, obviously, and then difficulty managing their daily life, something that they could usually do that they would find or complete with relative ease, and all of a sudden they're having a hard time with it. That could be an early sign. So it's just something to put out there, and you don't have to wait for a crisis in order to start to receive help. So go to the next slide. Sorry.
All right, so what is a crisis? When we talk about a crisis, we're really talking about those moments that throw us off balance, things that feel unpredictable, overwhelming, and sometimes even dangerous, whether it's emotionally or physically. Crises often come out of nowhere, and in those moments, the usual ways we cope just don't seem to work, which can be really unsettling. One thing we know is that change and crisis kind of go hand in hand. So change can cause crisis, and crisis can lead to more change. And anytime something major shifts in our lives, it naturally brings us a sense of vulnerability. We feel like we've lost control, and the instinct is to try and get that control back however we can. Next. So the symbol in the top right corner here is actually the Chinese word for crisis, which I love. So it's commonly seen as the first symbol is danger, and the second symbol represents opportunity. And the danger represents a threat to our physical or psychological safety, the part of a crisis that makes us feel unsteady or overwhelmed. But within that same moment is also the second piece, which is the opportunity, the chance to decide how we respond, which is a crucial point when something begins to change. So a crisis demands some kind of response. And while we can't always control the situation, we can control the tone we set, the presence we bring, and the support that we offer. And this is where the power really lies. There's something important to note that when a teen is in crisis, they obviously may say or do things that trigger us as parents or caregivers, loved ones. We might feel helpless, frustrated, or even personally attacked, and that makes it really hard to think clearly at times. Sometimes their crisis might seem super small from the outside to us, but for them, it could be tied to something in the past, something that hurt them, or actually deeper emotional struggles. If we come into that moment with our own stress or judgment, it becomes hard for them to really trust us, and that connection kind of shuts down. So just a parent tip, when a teen needs what they need most in these moments isn't really a lecture or a fix. It's calm, steady presence and just showing up with patience and compassion, and that can really help them feel safe enough to regain control and open up to us.
Hi everyone, my name is Marissa. I am a therapist by training. I've been a therapist at Bloom for a few years, and I'm currently in a role for community engagement. And something that came up a lot when I was doing therapy with teens and adolescents was self-harm and suicide ideation. I think when we think about a crisis or we think about mental health, some of the things that we automatically jump to do revolve around issues of self-harm or suicide ideation or suicidality. So we really wanted to take a second here to talk about this. One, because talking about it is important. And I think one of the things that we're often most afraid of is talking about it itself. We're afraid that if we discuss self-harm or suicide ideation with our teens or young ones in our life, that we are going to give them the idea. But that's actually not the case. Talking about it can really help us understand what the issue is and if there is a safety issue that needs to be addressed. And it's not going to introduce the idea into their heads. It's in popular culture, right? We hear about these things a lot, and they're going to get ideas, even if we don't talk about them. So we hope that this will just help to, like I said, maybe demystify or make you feel a little bit more educated and empowered to know what to expect if you do discuss this with your teen and then a mental health professional. So when we as clinicians assess for suicide ideation, we do differentiate between active and passive thoughts. So this is something, if your teen is maybe receiving mental health treatment and they start to bring up these things, they'll be asked about this as well. This helps us to understand what level of care the child, teen, adolescent needs to keep them most safe. So passive suicide ideation means thoughts of death or dying without intent or plan to act on those thoughts. A very common example of this that we see is, I wish I could fall asleep and not wake up, right? It's a very passive thought, but it is one of those dark thoughts that we do hear sometimes. This, as opposed to active suicide ideation, is when we have actual thoughts of suicide or death with an intent and or maybe a plan to carry that out. So means, method, or a plan. When we see all of those things together, that's signs that there is a more serious issue at hand, and that general guidance would suggest the patient child, adolescent, would best be seen at a higher level of care, which we'll discuss here in a second. With passive thoughts of death, it is still scary, right? It's alarming to think that your child is thinking these thoughts, but often these are thoughts that can be managed in an outpatient setting, depending on the child, their history, and all of the other contexts we take into account when we're thinking about how to best respond to them and keep them safe. Some other kinds of warning signs we think about or maybe want to observe without all the time pathologizing, right? But are thinking about if they're talking, journaling, or researching things related to death, maybe like giving away possessions is a common behavior seen. Risky or careless behaviors, self-injurious behaviors, which is SIB for short, social isolation, and one of the most common emotions associated with suicide ideation is hopelessness as well. Loss of interest in or loss of pleasure in enjoyable hobbies that they used to really find enjoyable. And then we also have maybe a friend, loved one, or even an influencer on social media passing away by suicide. That can sometimes also be a warning sign or a risk factor for someone. So when we think about suicide ideation or suicidality, we often do think about self-harm. However, the two do not always go hand in hand, right? So self-injurious behavior is also called self-harm. It's also called non-suicidal self-injury. There are very, very, very many reasons why a teen or anyone of any age would think about self-harm, right? A lot of kids do that as a way to cope. So it is a maladaptive and impulsive coping skill, and it involves harming the body in a non-lethal way. So some of this might include scratching, cutting, burning, or headbanging. It is a symptom of a mental health diagnosis. We often see self-harm as the problem in and of itself, but it is actually something deeper within that child that needs to be addressed. And self-harm is a way that they're trying to cope with or regulate what they feel. So self-injurious behavior does not always mean the child is actively suicidal, but it is a behavior that we want to address. So if you do ever observe these behaviors in your child, or we see marks of self-harm on them, it is something that we do want to seek help for rather quickly. And it's okay to ask your child about it and to talk with them about it if that feels comfortable. But it is definitely something that we would want to seek treatment for, maybe starting with therapy, and then we can make an assessment for if and when medication would be helpful. Something else that we wanted to include for a crisis resource for you all, and this is something a parent or a teen can use, is 988. So 988 is the Suicide and Crisis Lifeline. It's funded by SAMHSA, which is the Substance Abuse and Mental Health Services Administration, and it is 24/7 live support. You can text, you can call, and you'll be connected with someone who is live and trained in crisis stabilization, and they will be able to help your child if they call and need help in that moment right then. So there is a website for 988, I'm pretty sure, as well, and there are actually a couple of different like texting resources that teens use. Some of the kids I used to work with would use them and find them really helpful to just maybe have someone help to point them in the right direction and tell them, like, I think it's time maybe we seek more help. So turning it over to Dr. Nene for how we can also assist in a crisis.
Yeah, we have just recently launched a child crisis center. So if we think about this, if a child is in distress, it can be quite scary to go to the emergency room. I think we can all agree on that. Or it can be quite scary to go to an urgent care center. So, what we do is we would make ourselves available to that child and adolescent immediately, within an hour if they're struggling. I'm a child and adolescent psychiatrist by training, and so they could see me or one of my colleagues, and we would have a comprehensive evaluation. Now, some of those children or adolescents may meet criteria to go to a hospital. And we have a wonderful relationship with Dominion Hospital and HCA, where we would admit them comfortably into a hospital. However, that wouldn't be the first priority. The first priority would be to step down to our outpatient clinic and have them see an outpatient provider and an in-network therapy referral within Bloom. And so this way we can take the pressure off of mom and dad. We can take the pressure off of the schools, the guidance counselors, the principals, as well as the teachers, our hardworking educators. It's a way to support the school system. And this is recently launched. We have a program based out of Manassas. However, it is virtual. And we will be offering that to those in Arlington, DC, Maryland as well. So like I said, it's a easy access point for children and adolescents and their parents to get quickly evaluated and to determine what the next steps are. And if the steps are outpatient, we have you covered. If the next steps are or is inpatient, PHP, or IOP, we still have you covered because of our great relationship with Dominion Hospital. And you would get one of our providers to work with your child and adolescent during their time of need. So it's a fairly new service. It's the only service in Northern Virginia through a private group. But I think everybody who has tried it is pretty happy with it. So we just want to let you know of this opportunity as well.
Okay, so we wanted to also talk about the different levels of care. There is a big range when it comes to how we can receive mental health treatment. So starting from the lowest level of care and then gradually working your way up is the general guidance. Again, as long as there is not any active suicide ideation or self-harm going on. We want to start at the lowest possible care and work our way up. So the lowest level would be outpatient. So outpatient therapy like we provide at Bloom. And that is when you're seeing a weekly therapist. Maybe you see twice a week, depending on what the need is, and maybe every other week. But we generally like to start with weekly sessions. That typically is individual at Bloom, but there are some providers who will do family sessions, and hopefully we'll be doing group therapy soon. Some of what that might consist of is general talk therapy, cognitive behavioral therapy, when we're really trying to think about the thoughts that we have in our head, how that affects our behavior, and how that affects our emotions, and trying to identify if there's a behavior or a thought, or maybe even an emotion that we want to change to help ourselves regulate. We have dialectical behavioral therapy, which is a mindfulness-based therapy modality that has a lot of different components that help with emotion regulation and interpersonal effectiveness. So really building up on those communication and relational skills. There are maybe short-term or solutions-focused based therapy that help us identify a specific goal and work towards it. And then family systems therapy as well is usually very helpful when an adolescent is in therapy. So kids in therapy, adolescents in therapy will really work on coping skills, adaptive coping skills especially, communication skills, relationship skills, etc. And then we also have outpatient psychiatry. The two can often go hand in hand. We do both at Bloom, and often we see patients who are receiving therapy and psychiatry at the same time, different days. But that would include medication, and that would be either with a psychiatrist, a nurse practitioner, or a physician's assistant. And like I said, that's often in combination with therapy. And we do have specialized child and adolescent psychiatrists or psychiatry providers who really, really specialize in working with teens and adolescents and their developing brains and bodies. We also then have the next kind of level up here is for intensive outpatient therapy. So that's when you're maybe going 3 to 5 days a week for several hours a day, maybe 3 or 5 hours a day. This is a more structured therapy modality. And it is for moderate to moderately severe mental health conditions. So maybe we're in therapy and we're not really seeing the benefits that we need. We'll step up to a higher level of care. That almost always includes individual therapy and group therapy and medication management. However, that's usually optional.
All right, so getting into more levels of care. So the next level of care that would be technically the next highest is partial hospitalization, which is sometimes called PHP, and that's pretty much a day program for mental health. So teens attend treatment several hours a day, usually about 5 days a week, but they go home in the evening. So it's more structured than IOP, but less than inpatient. It's ideal for teens who need more than the weekly therapies like we offer at Bloom, but don't necessarily need a 24/7 round the clock care. PHP can include group therapies, individual sessions, a lot of times family work, and often there's dedicated academic support built right into the day, which is very helpful. The next level of care, which is typically the highest level of care, is inpatient. So inpatient is typically short term. It's a hospital-based care, and it's designed for situations where a teen is in immediate danger of hurting themselves or hurting others. So it's really focused on the safety and stabilization. Teens usually stay for a few days, just long enough to really get that crisis under control and assess what kind of ongoing support is needed. So the next is residential, and sometimes it gets confused with inpatient because they are both 24/7 care. But the difference with residential treatment is that it's really in a non-hospital setting where teens can live there on site for a longer period of time. Sometimes it can be 30 to 45 days. And it's for youth who are struggling with ongoing or more complex challenges like depression, anxiety, trauma, or sometimes even substance use. They receive intensive therapy, medication support if needed, and just daily structure in a therapeutic environment. It's less about the crisis management and more about the deep healing and the skill building. But what's important to note is across all of these levels, the mental health professionals that are working with the teens work really closely with the schools to minimize disruption to their learning. So whether that means helping them coordinate their assignments, attending school meetings, or even creating a transition plan back to school, we're committed to making sure that the teen stays on track emotionally and academically.
Yeah. So how do you support your teen when they're going through something like this? One of the best things, most effective, is just to be open and non-judgmental when you're talking with your kid. One of the biggest barriers that I see for children and adolescents getting help is oftentimes built up in their own heads, feeling like they're alone, like they're going to be judged for if they talk to their friends or their parents about what's kind of going on. So just to kind of approach it without um, any judgment. And then kind of touching on what Dr. Nanu was talking about earlier, those changes that you might notice in your child. And it's important to ask them questions. Oftentimes, I'll hear from adolescents saying that nobody's really paying attention to me, and nobody kind of understands me, whereas all along, parents were noticing these different kinds of changes. It's important to approach your teen or teen or child kind of with from a point of curiosity, because oftentimes they will feel, even if you're not trying to, they will feel judged or anxious about it. So if you're kind of more open and curious, that can go a long way to kind of breaking down a lot of those barriers that they might have built up in their head. Another important way to support them is to set boundaries, which is often very difficult with young people, but do so while offering empathy. So I know a lot of issues arise around the phone. It's become a big thing. And how do you navigate boundaries around the phone? Or like if they want to go out with their friend, then it's not a night for that, or if there's other things going on. But to acknowledge their frustration or their feelings while setting those boundaries, as opposed to kind of negating their feelings or dismissing them. That way it kind of, again, they're being seen for them as a person, as opposed to feeling like their emotions don't count. And then also modeling healthy coping strategies and communication skills. So kids and teens, they're like sponges. They will pick up on your behaviors. And so if you are, if you're feeling stressed and you do your deep breathing, or you go on a walk and you implement those kinds of pro-social coping strategies, they will have a better chance of implementing those as well. And then also get support for yourself. It can be really difficult and challenging kind of caring for young people that are struggling with these kinds of issues. And caregiver burnout it's a real thing. And so make sure you're paying attention to your own mental health while helping them along the way.
Right. So how can Bloom support your journey and your child's journey? We are a clinical organization that really, we're not about gimmicky phrases and stuff like that, the stuff that you read online. I mean, it is really the family and the patient to that's our core mission, right? And so we will see anybody, irrespective of age, disease severity, or insurance status. So we take every insurance, even though it says accept most, there isn't one that I can't think of right now that we don't take, but we take all commercial insurances, all Medicare, all Medicaid. And we really are trying to integrate ourselves into the family and support the children. And we have an inpatient team, a partial team, like I had said before. We have an outpatient team, and we have a therapy team. We also offer non-medication strategies such as TMS and Spravato that we can talk about for those that are struggling a little bit more with their mood. But again, the most important thing I'd like to say about our organization should not, when you call an office, it shouldn't be what insurance do you accept, or does this person take this insurance, or does this person have this availability? It's like, no, when is your next availability? We'll take care of the rest. And that's the vision of Bloom, is we will see anybody who is struggling, irrespective of their insurance status and age and whatnot. So if there's ever a need, feel free to reach out, and we're here to support you. We have same-day appointments, same-day intakes. We have evening hours available, and we're here to support the community. And as you can see, these are our locations. We have Arlington, Alexandria. We're down south in Charlottesville, as well as in Richmond, but we're also in Manassas, Winchester, and Leesburg as well. And on the Virginia side, you can see our Maryland locations. We're really not focused on Maryland right now, but if any of you guys are from there, we have in Annapolis, Baltimore, Bethesda, around the DMV as well. And then we just opened our new clinic on L Street, which is near the Senate in Washington, D.C. Oh, Kristen, sorry.
Sorry, couldn't get off mute.
Okay.
So how to get started with mental health care, talk to your teen about their needs, meet them where they're at. That's really important. And know what options for different levels of care. I know we talked about different levels, and if you're not sure what level is appropriate, reach out and we can help support you in figuring out what that is. And then community resources and also crisis resources. So we want to go over some of those resources and partners that we've built in the community so you have those.
Okay, so as I said before, I am a therapist, but my current role is in community engagement. So my role is really focused on expanding access to care, making sure that as many people as possible know about the services that we provide, but also finding resources for patients at every level of care, so that we can really increase care collaboration across the board in mental health. We're lucky to live in an area of the country where we do have a lot of resources available, and everybody is very, very collaborative, and it is a very compassionate group of people, no matter where you are. So as we said before, we have different levels of care, so we're going to provide examples for different groups that you could seek at any different level. So for outpatient therapy, we have Bloom, as well as outpatient psychiatry. For intensive outpatient, otherwise known as IOP, we have Dominion's IOP, which is wonderful. And we also have Charlie Health as a virtual only IOP, which can be really great, if you are in an area where it's hard to get somewhere in person, or maybe virtual is just more approachable. Compass Healthcare is also a virtual only IOP program in Virginia. Pasadena Villa Outpatient has several locations, one in McLean and one in Chantilly, and that is in-person intensive outpatient. They're both really lovely facilities. Embark as well. There's one really close to Tyson's. Newport is in Fairfax. And then Sandstone Care, they have several locations as well. Partial hospitalization, we have a lot of options here. You'll notice that a lot of the IOP PHPs, they're the same. So these ones offer higher level of care only, as opposed to Bloom, we do kind of the gamut. So PHP, we again have Dominion, Discovery, Pasadena Villa, Embark, and Newport. I know we're going through these a little fast, but I believe this will be sent out or recorded so that you can come back and know that these resources are here if you ever need them. Kristen?
And some more resources. So for inpatient level of care, which would really be that highest level of care, and could be voluntary or involuntary treatment, there is Dominion Hospital. They do see ages 5 and up. Stone Springs Hospital, we also partner with them at Stone Springs Hospital, but they are 18 and older. So if the youth is 18, we could also send them to Stone Springs. Shepherd Pratt is another option. As far as residential, you'll see some familiar names again here that have multiple levels of care. Pasadena Villa just opened a new location in Locust Grove, Virginia, which we actually had the pleasure of visiting this week. It's very nice. So that's another residential facility. Embark, Newport, Discovery, Sandstone Care actually has a primary mental health program in Maryland, but there's a lot of Virginia youth that go there as well. And then A Mission for Michael is big in our area as well. And then just some community resources, which are really important. So 988, which we've already discussed, which is the crisis line. It's a really great resource and it's free. It's 24/7. But also, a lot of people don't realize that we have community service boards in most of our counties, Fairfax, Alexandria, Prince William County, Loudoun, Rappahannock. There's CSBs everywhere. And this is really literally community service, and they help with mental illnesses, sometimes intellectual and developmental disabilities, and even addiction. And they also serve providers as well. So they help get patients placed. And then NAMI, the National Alliance for Mental Illness. This is a nonprofit organization that's really dedicated to building better lives for those affected by mental illness. And they offer different supports such as groups and just various services.
Sorry, so we wanted to throw this in here. I know we've talked a lot about Bloom services. We wanted to make sure that you know how to actually schedule an appointment and kind of what to expect in that process if you do decide to use any Bloom services. So we have a direct scheduling process. There are a few different ways one can schedule. We have online scheduling now live on our website, so it's super easy to go up on the website, bloomhealthcenters.com, click appointment, and then you'll be able to filter through for exactly what you're looking for. You'll see pictures, bios, and next available time slots for all of our team who has openings. But we also have a really, really wonderful referral manager. Her name is Rena, and she is the one to answer the phone anytime someone calls for a therapy appointment. Or if for psychiatry as well, maybe even also TMS, and she will handle everything. All she needs is your name and your information, and she will match you with a provider that fits your needs, your schedule, and make sure that you have someone who you're going to feel really comfortable with going into care. We do have a really fast turnaround, especially for our psychiatry appointments, and are often able to get patients in, like Dr. Nene said, maybe even same day, but probably same week, if not the following week. And then Again, here with our crisis resource line, we are able to maybe even see patients same day. And if they're in a crisis, we will absolutely help to triage, identify the best level of care, and make sure that they are set up to receive the care at the level that they need. So this contact is the contact information you see here is open for anyone who needs to call for an appointment. Again, our website is also a resource as well. And then finally, this is our information. So Kristen, myself, and Mickey, who's our Maryland counterpart. But if you ever have any just like general questions, maybe you're not sure who at Bloom to call, you can always call one of us. We're always happy to help. We can also connect you to others internally. We can absolutely transfer you to the person you do need to talk to if it's not any of us. So we wanted to make sure to throw our information in here as well. And last but not least, Kristen will wrap us up.
So this is one of my favorite quotes that I use often, but those who make conversations impossible make escalation inevitable. So just something, a little food for thought there. This is written by an author, Stephen Molyneux, who wrote the book, The Art of the Argument, which is really interesting. So.
And
Thank
that's
you.
that. So I think we are open for questions now.
We would like to thank our presenters tonight for joining us. We would like to thank each of the participants that joined us tonight for our presentation. In the chat, I have placed a survey if you would like to fill out the survey to give us feedback and any requests for additional sessions you would like information on. Resources from tonight's presentation will be sent to you via email, as well as the presenter's contact information. Once again, thank you for attending, and we hope everyone has a lovely evening. Good night.